Welcome back. My name is Nurse Veronica Obi, and today we'll be talking about painful menstruation. The medical name for painful menstruation or menstrual cramps is dysmenorrhea. This is a cramping pain that is felt at the lower abdomen and sometimes the lower back whenever a woman is having her period. For some women, it is mild, but for others, it is painful enough to interfere with their daily activities for a few days every month. The pain usually reduces with age, and in some women, it ceases completely after childbirth. Causes. Now, during menstruation, a woman's womb contracts to expel blood and tissues. A substance known as prostaglandin triggers this contraction. Now, when there are higher levels of prostaglandin, it means more contraction and a woman feels more pain. There are some other conditions that can cause painful menstruation. One of them is the use of intrauterine contraceptive device. This is a small contraceptive device that is inserted into the womb to prevent pregnancy. When a woman takes this method of contraception, they may have painful menstruation for about 3 to 6 months and it subsides afterwards. The next one is endometriosis. This is a condition where the normal tissues that are supposed to be found only in the womb begins to grow in other places such as the fallopian tubes and the ovaries. Another condition that can cause painful menstruation is fibroids and also pelvic inflammatory disease. There's also cervical stenosis. This is a narrowing of the cervix, making it difficult for blood to flow freely. There is also what is called adenomyosis. This is when the outer lining of the womb begins to grow into its muscles. There are a few risk factors for painful menstruation. Some of them are: you're younger than 30 years old, you started menstruating early, about 11 years and less, you have heavy menstrual flow, irregular menstruation, a family history of painful menstruation, and if you smoke. This puts you at risk of having painful menstruation. Symptoms of painful menstruation. The first is a cramping pain that is felt at your lower abdomen and can be severe. This pain can start 1 to 3 days before your period and subsides 2 to 3 days after your period. The pain can radiate from your lower abdomen to your lower back and even down to your thighs. Another symptom is the feeling of pressure in your lower abdomen. Some women also experience nausea, vomiting, diarrhea, headaches, and dizziness. You should see a doctor immediately if the menstrual cramps disrupt your life entirely and you can't do anything else. The second reason you should see a doctor is if you start experiencing menstrual cramps at 25 years or above. The third reason you should see a doctor is if the symptoms keep getting worse. Complications. Usually, menstrual cramps do not have any complications except it is caused by other health conditions like endometriosis or uterine fibroids. These can lead to fertility issues or even ectopic pregnancy. At the hospital, a pelvic examination, ultrasound scans, and other tests are done to diagnose menstrual cramps and its causes. Treatment. The treatment is usually with pain reliefs or prescribed hormonal contraceptives. Sometimes surgery may be done if the cause is from other health conditions such as uterine fibroids or endometriosis. Some home remedies for painful menstruation are soaking in a hot or warm bath, placing a hot water bottle or a hot compress on your lower abdomen to relieve the pain, physical activity, or massaging your lower abdomen and lower back. Some ways to prevent or reduce painful menstruation include exercise, reducing your stress level, especially psychological stress, avoiding alcohol and smoking, and reducing your caffeine intake. Remember, not all menstrual cramps are caused by normal menstruation. Some may be caused by other conditions such as endometriosis and fibroids. Especially if you are having an excessive painful menstruation, you should see a doctor to be sure. Till next time, bye bye.